After tooth extraction, it's important to take certain precautions to help minimize pain, reduce the risk of infection, and promote healing. Here are some common precautions to follow. Bite down on gauze. After the tooth extraction, your dentist or oral surgeon will place a gauze pad over the extraction site to control bleeding. Bite down gently on the gauze pad and replace it as needed until the bleeding stops. Apply ice. To help reduce swelling and pain, apply an ice pack to the affected area for 10 to 20 minutes at a time. Avoid solid foods. Stick to soft, cool foods such as ice cream, yogurt, or mashed potatoes for the first 24 hours after the extraction. Avoid hot foods and drinks as they can cause bleeding. Don't smoke or use tobacco. Smoking or using tobacco can delay healing and increase the risk of infection. Avoid using a straw. Using a straw can dislodge the blood clot and delay healing. Drink liquid straight from a cup instead. Take pain medication. Your dentist or oral surgeon may prescribe pain medication to help manage any discomfort. Follow the instructions carefully and do not exceed the recommended dose. Brush gently. Continue to brush your teeth and tongue, but avoid the extraction site for the first few days. Rinse gently with warm salt water to help keep the area clean. Follow your dentist instructions. Your dentist or oral surgeon may provide specific instructions based on your individual situation. Be sure to follow these instructions carefully to ensure proper healing and minimize complications.